Hello everyone, myself Nabajani Datta, Assistant Professor of Army Institute of Nursing is taking up a topic on care of unconscious patient. So before going for the care, we should know some of the terminology. First is loss of consciousness. So it is an apparent in a patient who is not orient, do not follow commands, or need persistent stimuli to achieve a state of alertness. Here, a patient is unconscious and they are unable to respond to the spoken words, which they can often hear what is spoken. Next is consciousness. So here patient is in a state of being awakeful and they are also aware of self and environment as well as the time. Next is unconsciousness. So it is a abnormal state which results from disturbance of sensory perception to the extent that patient is not aware of what is happening around him. So we'll see some of the levels of unconsciousness. First is alert, where patient is normal and conscious. Second is automatism. Here patient is aware of the surroundings, may be unable to remember the action later. Possible abnormal moods and may show defects of memory and judgment. Third is confusion. Here patient usually lost the ability to speak and think in a logical, coherent fashion. Next is patient can respond to simple order but may be disoriented for time and space. Fourthly, level is delirium or acute confusion with agitation, which is characterized by restlessness and possible violence, not capable to rational thoughts and may be troublesome and not comply with simple orders. Fifth is stupor. Here the patient becomes very quiet and uncooperative and uncommunicative. They remain conscious but sits or lie with a glazed expressions, do not respond to orders, bladder and rectal incontinence occur, and this stage of more serious than the previous stage, which is also known as wild stage. After stupor, sixth level is semi-coma, which is also known as twilight stage. Here patients often pass fitfully into unconsciousness and may be aroused to the stuporous state by vigorous stimulation. And last level of unconsciousness is known as comatose stage, where patients deeply unconscious and cannot be roused and do not wake up with vigorous stimulation. So let's see what are the causes of unconsciousness. Causes may be head injury, skull fracture, asphyxia, fainting, extreme of body temperature, cardiac arrest, blood loss by any means, cerebrovascular accident or stroke, epilepsy, infantile convulsions, hypoglycemia, hyperglycemia, drug overdose, hypothermia, poisonous substances and fumes. So these are few causes. Now let's proceed with the care. We have to first know the assessment of unconscious patient. So this can be done by collecting thorough history to find out the cause of unconsciousness. Secondly is physical examination, which include head-to-toe examination. Thirdly is Glasgow Coma Scale, which is very important to know the level of unconsciousness. It consists of total 3 components, that is eye-opening, verbal response and motor response. Eye-opening consists of 4 score that involves spontaneous to speech to pain and no response. Verbal response include orientation, confusion, inappropriate word, incompressible sound and no response. And the last is motor response, which include obey commands, localize, withdraws, flaxes, extends, and no response. Here total scores range from 3 to 15. Following with the assessment, next we have to do the evaluation of mental status. Then cranial nerve examination by doing neurological examination, reflexes both upper and lower extremity reflexes, motor and sensory function, scanning, imaging, tomography, EEG need to be assessed. Coming to the formulation of few nursing diagnoses as per the priority, we'll see ineffective airway clearance related to altered level of consciousness, risk for injury related to decreased level of consciousness, risk for impaired skin integrity related to immobility, impaired urinary elimination related to impairment in sensory control, disturbed sensory perception related to neurological impairment, interrupted family process related to health crisis, and last is risk for impaired nutritional status. These are few diagnoses, and in response to this diagnosis we will see how we will manage or care. For maintaining patent airway, we have to elevate the head end of the bed to 30° minimum to prevent aspiration. Positioning the patient in the lateral or semi-prone position. Suctioning to be done. Chest physiotherapy should be done prior to the suctioning. Auscultation need to be done in every 8 hourly or whenever needed. Endotracheal tube or tracheostomy care to be done. So this is the picture which shows the position that we have to maintain, that is 30° position, and can be kept in semi-prone position and with the oxygenation. Then second is protecting the client. We have to protect the client from getting any injury by putting the pad on the side rails. Then we have to restrain if patient is very violent. Take care to avoid any injury by removing the sharp instruments nearby to the patient's bedside. Talk with the client in between the procedures. Speak positively to enhance the self-esteem and confidence of the patient. Third is maintaining fluid balance and managing, which is very important, managing the nutritional needs. How? By assessing the nutritional status, providing adequate amount of liquids by using IV lines, liquid diets, and if oral intake is not adequate, we can start with the NG tube feeding. Then next, coming to the maintaining the skin integrity, which is very important. Regular changing in position, passive exercises, back massage, use splints or foam boost to prevent foot drops, special bed to prevent pressure on the bony prominences. Fifth is preventing urinary retention by doing the palpation of full bladder, inserting an indwelling catheter if required, administration of condom catheter for male and absorbent pad for female in case of incontinence, and inducing stimulation to urinate. Next, which is very important, is providing sensory stimulation, because patient may go into sensory deprivation. So what are the things we have to do is provide it at proper time to avoid sensory deprivation. Efforts need to be made to maintain the sense of daily rhythm or the works by keeping the usual day and night pattern for activity and sleep. Maintain the same schedule each day. Orient the client to the date, day, and time accordingly. Touch and talk, proper communication. Always address the client by name and explain the procedure each time. Next, which is very important perspective, is related with the family needs, because family have a full rights to be involved in the care of unconscious patient. So family support is very important. Educate the needs of the client. So we have to prioritize what are the needs of the client, and accordingly we have to see what are the cares we can involve the family members that they can give care to the client. And last, which is very important, is identification of potential complications. These are respiratory distress, pneumonia, aspiration, and pressure ulcer. So, when providing a care, we have to know that we should avoid this development of potential complications. So, this ends with the few important cares that is required for an unconscious patient. Hope all of you have liked the presentation. Please share if you think it is important. Thank you.